Assalamu alaikum. I am Dr. Mavi Saif. Let's start a very important topic, Group B Streptococcus in pregnancy. Streptococcus epilepticus gram-positive commensal bacterium commonly colonizing in gastrointestinal tract and genitourinary tract of up to 50% of asymptomatic adults. Commonly responsible for urinary tract infections, chorioamnitis, and endometritis during pregnancy. A major cause of neonatal sepsis. All women are screened via rectovaginal culture at 35 to 37 weeks of gestation for Group B Streptococcus infection. 50% of exposed infants will be colonized, but only 0.2% will develop symptoms of infection. Mortality rate, if symptomatic, from vertical infection, early onset Group B Streptococcal infection is 50%. Now, fetal risk. It is associated with preterm pre-labor rupture of membranes and preterm delivery. RCOG does not recommend routine antenatal screening for Group B Streptococcus infection. However, intrapartum antibiotic prophylaxis should be offered to a woman with a history of previous neonatal Group B Streptococcus infection. Prophylaxis should also be considered if Group B Streptococcus is discovered incidentally in either the vagina or urine, but there is no benefit to be gained from attempting to eradicate it antenatally. Intrapartum prophylaxis should be considered with the following risk factors such as prematurity, gestational age less than 37 weeks, prolonged rupture of membranes that is greater than 18 hours, and pyrexia in labor. The recommended prophylaxis in labor is IV benzyl penicillin, started as soon as possible after onset of labor, and at least 2 hours before delivery, 3 gram initially, then 1.5 gram every 4 hourly throughout labor. In case of penicillin allergy, IV clindamycin should be used, that is 900 milligram every 8 hours. Now, this is a very important chart. I have taken this from RCOG guidelines. You can see this. We will give a link in the description. It have told that what kind of patients require intrapartum antibiotic prophylaxis. I can explain this chart from this pregnant woman who's undergoing cesarean section, not in labor, and membranes intact, regardless of Group B Streptococcus carrier status, needs no intrapartum antibiotic prophylaxis. Pregnant women can have bacterial urine in current pregnancy. Oral antibiotics, if proven Group B Streptococcus, offer intrapartum antibiotic prophylaxis. If a pregnant woman at term goes into labor, there is no risk factor for early onset Group B Streptococcus infection. There is no need of intrapartum antibiotic prophylaxis. If in labor there is pyrexia, temperature is 38 degrees centigrade or higher, offer broad spectrum antibiotics, including antibiotic for preventing early onset Group B Streptococcus infection. Group B Streptococcus carriers colonization in current pregnancy, however directed, then offer intrapartum antibiotic prophylaxis. If there is pre-labor rupture of membranes, non-Group B Streptococcus carrier, however detected, immediate intrapartum antibiotic prophylaxis should be offered and induction as soon as reasonably possible. If unknown or negative Group B Streptococcus status, then there is no need of intrapartum antibiotic prophylaxis. If there is a preterm labor, offer intrapartum antibiotic prophylaxis. Previous infant with invasive Group B Streptococcus infection can offer intrapartum antibiotic prophylaxis. Group B Streptococcus carriers had in a previous pregnancy, explain likelihood of current pregnancy, offer intrapartum antibiotic prophylaxis or bacteriological testing 3 to 5 weeks prior to expected delivery date, usually 35 to 37 weeks. You can see this from RCOG guidelines. They have explained it very beautifully. Now, complications. Early complications are onset neonatal group B Streptococcus infection results in a fulminant pneumonia and sepsis, usually the result of vertical infection, usually manifest within first week of life, more common mortality rate of 50%. Risk factors are prematurity, previous baby affected of group B Streptococcus infection, positive urine culture. Late onset neonatal group B Streptococcus infections are often results in meningitis, may cause cellulitis or pneumonia, usually manifest after 1 week of age, may be acquired environmentally. Less common mortality, this is less common. Mortality rate is 25%. Now, this is very important point. Breastfeeding should be encouraged, irrespective of the group B Streptococcus infection status. Thank you so much. This was a important topic of group B Streptococcus infection in pregnancy.